This video is about the concept of equal pressure point in the respiratory physiology. It is defined as the point at which the airway pressure is equal to the intrapleural pressure. Understanding this concept of equal pressure point will help us to explain many observations in respiratory physiology, like why the expiration is more difficult in asthma, why there is an excessive dynamic airway collapse in obstructive disorders, and how does this pursed-lip breathing helps in the COPD patients. Let's start by describing the various pressures within the respiratory system. This is a schematic diagram. This outer box shows the chest wall, and this inner circle represents all the alveoli, and the space between the alveoli and the chest wall, this is the gray colored zone, is the pleural space. The pressure within the pleural space is called as the intrapleural pressure, and outside the chest wall with the pressure surrounding the body is the atmospheric pressure, and the pressure inside the alveoli is the alveolar pressure or intraalveolar pressure. The atmospheric pressure at the sea level is equal to 760 mm of mercury, and all the other pressures are generally referred to as the difference from the atmospheric pressure. For example, the alveolar pressure, if it is 761 mm mercury, it is just referred to as +1, or if it is 760, it is referred to as 0 mm mercury. Okay. And this is the airways which is connecting all the alveoli to the atmosphere. The pressure within the airway is called as the airway pressure, intra-airway pressure, or sometimes the BR here stands for the bronchial pressure, PBR. Now, this alveoli is connected to the atmosphere, so there is a direct continuity. So whenever there is a change in the pressure within the alveoli, it is going to influence the movement of air between the two, and it will attain equilibrium. So at equilibrium, the atmospheric pressure and the alveolar pressure is always equal. Now, the difference between the two pressure is called as transthoracic pressure. That is, TPP is equal to alveolar pressure minus the atmospheric pressure. It is 0 at equilibrium, the transthoracic pressure, but whenever there is a change happens, like during inspiration or expiration, it varies from +1 to -1 during tidal respiration. Next, the intrapleural pressure. The intrapleural pressure is always slightly negative during a normal respiratory cycle. It is because the alveoli is trying to shrink due to its elastic forces and also the surface tension forces, and the chest wall is trying to get bigger to attain its natural size. So since there are two opposite forces acting in this place, so the pleural pressure becomes negative. So it is, for example, it is varies from 754 to 756, so it is referred to as -6 to -4 mm of mercury during a normal breathing cycle. The difference between the alveolar pressure and the intrapleural pressure is called as transpulmonary pressure, TPP. It's also called as transmural pressure, that is equal to the alveolar pressure minus the intrapleural pressure. In a normal breathing cycle, the transpulmonary pressure varies from +4 to +6 mm of mercury. So this can be referred as the pressure which is trying to acts on the wall of the alveoli and trying to distend it. If the pressure is less than this, the alveoli will shrink more, or if it goes more than +6, the alveoli will try to expand more. So this is the transpulmonary pressure. There is another term called as trans-airway pressure, which is the pressure difference between the pressure in the bronchus, is the airways, PR, minus pressure in the pleural space, intrapleural pressure. Like the TPP, which can be regarded as keeping the alveoli open, this TAP keeps the smaller airways open. Like The alveoli, which is susceptible to the changes in the intrapleural pressure, which can expand or decrease, like the changes in the transpulmonary pressure can cause the changes in the size of the alveoli. Similarly, the smaller airways which are not supported by the cartilage and the bone, like the upper airways, they are not supported. So these unsupported airways are also susceptible to the pressure changes in the intrapleural pressure. So this difference is called as the trans airway pressure. Let's see what happens in a breathing cycle to these pressures and how does this changes. Let starts with inspiration. At the beginning of inspiration, the intrapleural pressure is around -4. So the respiratory muscles expands the thoracic cage, which causes the fall in the pleural pressure with more negative. So the pleural pressure becomes more negative and reaches a peak of -6 during a normal breathing. So since this pressure is becoming more and more negative, this will try to expand the alveoli. The expansion of alveoli causes the pressure within the intraalveolar pressure decreases. So at 0, at equilibrium, which is at equilibrium just before inspiration, now it goes to -1, and at the end of inspiration, it again, because of the movement of air, it again comes back to 0. So it becomes -1 millimeter of mercury at the peak. So here it's -1, here it is 0. So this difference in the pressure causes movement of air from here to here, so which causes the neutralization of the pressure. Now again during expiration, the inspiratory muscles just relax. So this brings the pressure back to -4, the intrapleural pressure. This causes the alveoli to go to its original shape. Now the volume of air which is higher causes from -1 to go to +1 millimeter of mercury. So during expiration, initially it goes to a peak of +1. This will cause the movement of air out of the lungs. So again it comes back to equilibrium to 0. Now these are the two pressures, PAP and the alveolar pressure. Now what happens to this airway pressure? Airway pressure depends upon multiple factors. One is the difference between the alveoli and the atmospheric pressure determines this bronchial pressure, and it also depends upon at what site we are going to record this bronchial pressure or the airway pressure. For example, during expiration at peak, here if it is +1 millimeter of pressure and here it is 0, now the movement of air will causes change in pressure, but the resistance offered by these airways will decrease the pressure change which actually happened. So it is gradually going to become, instead of +1 here, it is going to become +0.9, +0.8 and 0.7, and gradually it is going to decrease and finally it is going to become 0. So the pressure linearly decreases during this expiration. It linearly decreases from here to the mouthpiece, and this decrease will depend upon how much is the resistance offered by this airways. Now if you have noticed, this alveolar pressure is always higher than this intrapleural pressure during a normal breathing cycle. So this is much negative, -4 to -6, but this varies from +1 to -1, which is always positive. So the changes which is happening in the bronchial pressures, which are also almost similar to this. For example, if we record closer to the alveoli, it is going to almost become, let's take a different color. If we record here at this point, slightly inside, this is going to almost follow close to the changes in the alveolar pressure. If you record much farther away from the alveolus, the pressure changes are going to become much smaller, like this. So it depends upon where we are recording and how much is the alveolar pressure, which will determine the airway pressure at any given point of time. Now since the alveolar pressure is always higher than the intrapleural pressure, similarly the bronchial pressure is always higher than the intrapleural pressure during a normal breathing cycle. So there is a pressure, the bronchial pressure is always higher, so it keeps the smaller airways expanded. But what happens in forced expiration? During forced expiration, the intrapleural pressure goes to much higher, like plus 15, plus 20. Let's take an example of here. Let's take as plus 10. So during, from -4, -6, it goes up to plus 10. The intrapleural has become plus 10, which higher because of the contraction of the expiratory group of muscles, and then the size of the thoracic cavity has decreased. Now this will cause alveolar pressure also from 0 to go slightly more than the intrapleural pressure. For example, if this has gone to 10, then this will go to 14 millimeter of mercury peak. So here it is 14 millimeter of mercury, here it is 10 millimeter of mercury. This is the plus 10, which is the intrapleural pressure, and here it is 0. Now this pressure gradient is going to cause the movement of air, and the pressure is going to increase in the airways, but it is gradually linearly going to decrease till the mouth. For example, here it is 14, then it is going to become 13, 12, 11, 10, and so on. So gradually it will decrease and become 0. Now the point at which the airway pressure is getting equal to this intrapleural pressure is called as the equal pressure point, that is EPP. Also we can say as the trans airway pressure has become 0, that is the difference between PBR minus PIP has become 0. So this is the point what we are learning to understand. Now what is the importance of this point? Like above this point, slightly above this point, if you notice here, this pressure is going to become lesser than the intrapleural pressure. So the pressure outside is higher, which may try to compress this airways. Airways is also again susceptible to the changes here, like our alveoli. Now in a normal individual, this equal pressure point happens within the airways where it has the cartilage support or as the bony support. In people with higher resistance in the bronchus, the pressure decrease is much steeper, and this equal pressure point happens within the airways, smaller airways, which doesn't have a support. So this will cause compression of the airways during forced expiration. So this is a normal respiratory system, and this is the obstructive disorder, patient with obstructive disorder where the airway size has decreased. Now in a normal individual, the equal pressure point happens within the airways which have cartilage support, so there is no problem of compression. But the patient with higher resistance, the drop in the airway pressure is steeper, and then it causes the equal pressure point to happen within the airways which doesn't have support, the bronchioles. So now what happens, slightly above this airway is going to collapse, and it's going to cause us difficulty in breathing. So this is the dynamic airway collapse, which is happening only during expiration in the obstructive disorders. And these obstructive disorder patients will try to do the pursed mouth breathing, that is they will try to obstruct here, they breathe through the mouth and then they decrease the orifice. So what will happen, it will not allow all the air to go out, so the air will accumulate here, the pressure within the bronchus will rise and it will keep the bronchus open. So this will help them to decrease the energy of breathing. Otherwise every time this airway will collapse and it will be difficult for them to stretch open again. By this pursed lip breathing, they will be trying to maintain more pressure within their airways and keep their airways open. Please leave a feedback if it was useful, and thanks for watching.